Rheumatoid arthritis when the immune system turns against you. Have you ever seen a loved one struggle with persistent joint pain, waking up with such stiffness that even opening a small jar feels impossible? Or perhaps you yourself are living with swelling, burning sensations and aching joints that make you feel like your body is turning against you. If this sounds familiar, then today's topic might be closer to home than you think. We're talking about rheumatoid arthritis, a condition that goes far beyond joint pain. It can destroy joints, cause disability, and deeply affect the body as a whole. In this video, we'll explore this disease in depth, from causes and symptoms to diagnosis, treatment, and most importantly, how to live with it. Part 1. What is rheumatoid arthritis? Rheumatoid arthritis, or RA, is a chronic autoimmune disease in which the body's immune system, designed to protect us, mistakenly attacks the lining of the joints. Key features of RA include: it affects multiple joints, typically symmetrical, both sides of the body. It usually begins in small joints like fingers, wrists, and ankles. It's progressive, meaning it worsens over time if left untreated. RA doesn't stop at the joints. It can also affect the lungs, heart, eyes, blood vessels, and even the blood, making it a complex, full-body disease. Part 2. Causes and disease mechanism. While the exact cause of RA remains unknown, research has shown that it arises from a combination of genetic predisposition. People with certain genes like HLA-DR4 or HLA-DR1 have a higher risk. Environmental triggers. Smoking certain bacteria, e.g. in gum disease and dust exposure, may trigger the disease. Immune system dysfunction. This is the core issue. Let's look at the mechanism step by step. Environmental triggers alter some of the body's proteins, like type 2 collagen, through a process called citrullination, making them appear foreign. The immune system mistakenly identifies these proteins as threats. T cells and B cells become activated. B cells produce autoantibodies like rheumatoid factor RF and anti-CCP antibodies. These antibodies bind to the altered proteins, forming immune complexes that accumulate in the joints. Cytokines like TNF-alpha and IL-6 are released, causing intense inflammation. The synovial lining grows abnormally and forms pannus, which destroys cartilage and erodes bone. The result: chronic pain, joint deformity, and loss of function. Part 3. Clinical symptoms and extra-articular signs. RA often starts subtly, but its hallmark features are morning stiffness lasting over 1 hour, pain, swelling, warmth, and redness in small joints, especially fingers and wrists. Symmetrical joint involvement. Both sides of the body are affected. As it progresses, larger joints like knees, elbows, and shoulders can become involved. Over time, joints may develop deformities like ulnar deviation, swan neck, and boutonniere deformities. Loss of function. Daily tasks become harder or impossible. Beyond the joints, RA can cause rheumatoid nodules, firm lumps under the skin, often near pressure points, pericarditis and pleuritis, inflammation around the heart and lungs, interstitial lung disease and anemia, Felty syndrome, a rare triad of RA, splenomegaly, and low white blood cell count, increased risk of atherosclerosis and stroke. RA is truly a systemic illness that goes beyond joints. Part 4. How is RA diagnosed? Doctors use the ACR-Euler criteria to diagnose RA based on number and location of joint involvement, duration of symptoms, typically more than 6 weeks, blood tests for RF, anti-CCP, CRP, and ESR, ruling out other conditions. Supportive tests include blood work, positive RF and anti-CCP, elevated CRP and ESR, X-rays, joint space narrowing, bone erosion, ultrasound or MRI detects early joint inflammation and structural damage. Early diagnosis is critical to prevent permanent joint damage. Part 5. How RA impacts quality of life. RA affects much more than physical health. It reshapes one's entire life. Difficulty with basic daily tasks, dressing, eating, writing, persistent fatigue and chronic pain, increased risk of depression and isolation, job loss or reduced work capacity in severe cases, financial burden from long-term treatments, tests, and medications. Without proper management, RA can be devastating to mental, emotional, and social well-being. Part 6. Effective treatment strategies. The good news: RA can be managed effectively with the right treatments. Traditional DMARDs. Methotrexate is the cornerstone. Others: sulfasalazine, hydroxychloroquine, leflunomide. Biologic therapies target TNF-alpha, IL-6, or B cells. Used in patients who do not respond to traditional DMARDs. Short-term corticosteroids help control flare-ups quickly. NSAIDs reduce pain and inflammation temporarily. Non-drug strategies, physical therapy, and joint-friendly exercises like yoga or swimming. Anti-inflammatory diet rich in fish, leafy greens, and omega-3. Stress reduction, adequate sleep, and emotional support. RA treatment requires ongoing monitoring, consistent medication, and teamwork between patient and healthcare providers. Conclusion and call to action. Rheumatoid arthritis may not be curable, but with early diagnosis, the right medications, and lifestyle adjustments, many people can live active, fulfilling lives. If you or someone you know has persistent joint stiffness, don't wait. Seek medical advice and screening as soon as possible. If you found this video helpful, please share it with your family, friends, or anyone who might be affected. Education today could be the key to preserving mobility and joy tomorrow. Thank you for watching. Stay tuned for more videos on bone and joint health.